Welcome to Language Access Matters, the podcast that dives deep into the crucial role of language access in public services and businesses. I am your host, Carol Velandia, and I invite you to join me on a journey of discovery and empowerment. Language access is not just a matter of convenience. It is a fundamental human right and the key that unlocks doors to essential services and opportunities. In this podcast, we'll explore the far reaching impact of language access, examining how it shapes not only healthcare, justice, and education, but also the world of business. Through thought provoking interviews, insightful discussions, and compelling stories, we will unveil the power of language access. We will hear from professionals who bridge communication gaps to provide quality care for diverse communities. We will explore the intersection of language, law, and justice, and the crucial role that interpreters and translators play in ensuring fair and equitable treatment. We will delve into the challenges and innovations as well as how language access opens doors to effective communication and inclusion and how it makes our society more equitable. But our exploration doesn't stop there. We will also uncover the profound impact of language access in the world of business. We will hear from entrepreneurs, industry leaders, and experts who understand the value of inclusive and effective communication and how it drives success in today's global marketplace. Language Access Matters is your platform to understand the significance of language access in these vital sectors of society. We will shed light on the barriers faced by individuals and communities and the innovative solutions that promote inclusion and equality. Whether you are a healthcare professional, a legal expert, an educator, a business owner, a linguist, an advocate, or simply passionate about the power of language, this podcast is for you. Together, we will navigate the challenges, celebrate the victories, and advocate for a world where language access truly matters. So, join me on this enlightening journey as we uncover the impact of language access in healthcare, justice, education, and businesses. Let's amplify the voices of the 25 million people that don't speak English in the United States and those that don't speak the dominant language around the world. Those voices deserve to be heard and empowered, and we need to empower ourselves to build a more inclusive future. Welcome to Language Access Matters. Let's embark on this transformative exploration together. Good afternoon. We have today Natalya Mytareva. She is a Master in Arts and she is also a core CCHI interpreter. Also has the credential of ICE and CCP. She's Executive Director of the Certifying Commission for Healthcare Interpreters and a Commissioner of the National Commission for Certifying Agencies, the NCCA. Between 2000 and 2013, Natalya was Communications Director at the International Institute of Akron, a refugee and resettlement agency in Ohio. She developed and taught several courses for healthcare and court interpreters, with the focus on language of lesser diffusion. She is a recipient of the 2023 Language Access Champion Award from the National Council on Interpreting in Healthcare. Natalya is a Russian interpreter, translator, and started her career as instructor of interpretation and translation courses at Volgograd State University in Russia in 1991. She holds a combined bachelor's and master in arts degree from Virginia State University in philology and teaching English as a foreign language. Natalya, we are so delighted to have you here. It is an absolute honor and congratulations on your award as a language access champion earned at the National Council on Interpreting on Healthcare. This is such an honor to have you in our podcast. Welcome.
Well, thank you, Carol. And it's an honor to be here. And, you and I have known each other for years and we've participated in different, events. So it's a pleasure to be here and talk about language access today. And the word that you mentioned is very dear to my heart. And I hope that even after it, I continue to contributing to improving language access for people who need it in this country.
We hope the same. We are definitely in the same thinking in the same direction. We're fellow advocates, and that's why I love to have you here. Also, because the topic we're about to talk about today is on certification. So let's start by telling our audience what is the Certifying Commission on Healthcare Interpreting.
All right. Well, CCHI, Certification Commission for Healthcare Interpreters, is a national organization. It's a nonprofit that has the mission to develop and administer certification exams for medical interpreters in the United States of any language. And we're very proud that we actually have the structure to do that. We offer two paths to certification that is skill based. In other words, not only we check the knowledge, but we also check the interpreting skills. So if you are interpreters of Spanish, Arabic, and Mandarin, we have one path. You take the knowledge exam in English about medical interpreting in the United States, and then you take the bilingual traditional interpreting exam between Spanish and English. But for interpreters of all other languages, right, thousands of other languages, the path is slightly different. After passing that first exam, you have to take a performance skill exam that is monolingual and assesses your cognitive interpreting skills in a different way, but gets the same results because we've conducted a study which compared the two exams. And that study was in 2020. And it confirmed that there is a correlation, significant correlation between these two approaches to testing interpreting skills. Because ultimately, the difference is between a person who simply speaks two languages and an interpreter who can interpret, right? And it could be assessed in different ways. We're proud that since 2009, this year we are celebrating our 15th anniversary, which is kind of like seems like it was just yesterday. But since 2009, we certified over 8,400 interpreters of many languages. And last year, when we added that second path, that for interpreters of all other languages to get skills certification that we call COSCHI performance certification. Um, we certified 160 individuals, and there we are really excited about the languages that we see who got certified. So among those 161 candidates, we have certificants. We have interpreters of Russian, ASL, Cantonese, Japanese, Portuguese, Vietnamese, French, but and some other languages such as like Greek, Farsi, Mixteco, Turkish, Yoruba. So we really what we wanted to see, to have this certification available to any interpreter in the United States.
And I want our listeners to understand that the Certifying Commission on Healthcare Interpreters, which I'm going to refer to as CCHI going forward, has really done a tremendous contribution in the professionalization of healthcare interpreters since it was created. I think there is a lot of misunderstanding around what it means to be certified interpreter. And we are going to talk a little bit about that in the podcast. Tell us a little more. What is the significance of CCHI and how it has impacted the quality of language access services in healthcare settings?
A couple of things. First, we all in our public conversations about our profession, and when we have discussions at the HR hiring levels or in the legislation, when we talk about interpreters, a lot of people mention qualified interpreter, right, and not talk about certified interpreter, and this definition of qualified interpreter is rather broad. Some people can say, well, you did your 40 hours training and now you're qualified. But I think everybody would understand that just taking a course doesn't make you qualified. You just took the course. You may even pass the knowledge test after the course. But all which was tested on that post course test was your knowledge of what was taught to you. Right. While it comes to profession, when you're able to, when you need to actually do things, there's much more to it than just having a knowledge of a couple of courses or having a couple of training exercises. So, certification compared to academic courses or training courses differs, in fact, in that we actually start with what do you do on the job with the profession itself. And the certification exam starts with grading the job task descriptions. The job task analysis is a national survey that we already have done 3 times because profession change, right? And so then based on this survey, we define what the interpreters do on the job. And then after that, we create the exam. And what we test is not based on any one specific course. We just want to know, can you interpret in healthcare in the United States settings or not? And that's a big task because, it could be public health department appointment. It could be labor and delivery appointment. It could be emergency room appointment where anything could happen, right? So there could be mental health, pediatrics. So all that we're supposed to test. And so that's obviously there are certain, tricks of the trade that we know how to get to there. But we see the significance of certification in the fact that actually it's the only way to assure that the interpreter is qualified. Because if you look at the definitions that are proposed, and I just want to touch upon the latest one by the final rule of the Section 1557 of the Affordable Care Act, which was just, adopted in May of this year. So when we look at that definition, it asks for pretty much 3 things, broad things. One is, has demonstrated proficiency in English and language other than English, both understanding and speaking it. Right? How would you determine that somebody had demonstrated if you are an employer and if, let's say, you are even a Spanish speaking bilingual HR person? How do you know that the person who comes to you and they say that they speak Yoruba, how do you know that they speak Yoruba? How do they need to demonstrate to you, right? They can bring their family member saying, they can bring you a birth certificate, I'm from the country where this language, but it won't do anything, right? So you cannot really prove that they speak until you have some qualified verification of that. That could be a test. It could be proof that they completed college, let's say French, right? I studied in France and I have masters from France. Well, obviously, they won't give you a master's in anything if you didn't understand French, right? So these are the one things. Another part of that definition is this: a qualified interpreter is a person who is able to interpret or interpret effectively, accurately, and impartially, receptively and expressively, using any necessary specialized vocabulary while preserving the tone, sentiment, and emotional level of the original oral statement. Again, how would an HR person verify that on the spot? Right? I can give you a certificate saying that and I actually did complete 40 hours of bridging the gap training, where that, was taught that I'm supposed to interpret accurately. But that certificate doesn't say that I actually do and I'm able to. I learned about it, but I'm not able to do it. That certificate doesn't demonstrate that. And the third aspect of that definition is that qualified interpreter adheres to generally accepted interpreter ethic principles. Again, how would you know as an employer that this person, Spanish, Russian, Cantonese, whatever, Arabic, adheres to the code of ethics? How? Uh, what certification does is not only we test the knowledge about these things, including about ethics, about how to interpret, we test the actual skills. Can you interpret? But then the last piece is we have a disciplinary policy that requires our certificates to follow those code of ethics. And if they do not follow it, we can take disciplinary actions up to legal action. And on our website, if you search for like disciplinary sanctions, we actually have a page with people. I think right now there are maybe 3 individuals there who were sanctioned. And two of the cases, in one case, the certification was revoked because the person violated ethics to the degree that we could not, keep that person certified, right? So that's how being certified gives the employers assurance that this person actually meets the definition of qualified interpreter. So what I'm, think that is the biggest contribution of our certification is having this mechanism that you don't have to bring 10,000 copies of anything. You don't have to demonstrate anything. You just bring one certification credential proof saying that you are certified, and you hit all these things. And then another thing, to look at this same issue of what is our contribution and what's our impact to the quality of language services in healthcare settings, is the fact, of taking the exams and passing or failing it. From our perspective and from the profession perspective, we really count how many people get certified, right? But for the public safety, really what's important is identifying those individuals who fail the certification exam, because that means that they do not know how to interpret, that they do not know about the code of ethics, and that means that they potentially could be a threat to the human life, to different legal aspects of performing healthcare in the United States. And so if you look at our, passing rates, like in 2023, 75% of candidates passed our knowledge exam, core CHI, which is about your ethics, terminology, and how to interpret. That means that 25% did not pass it, right? And that means that and usually who comes to us to get certified? Those who are already working as interpreters, those who see the value because their pay could get higher or their employer requires certification. So if these individuals fail that exam, that means that they've already been doing a substandard work somewhere, right? Then we take Spanish candidates. They pass the course HI. Out of those who come to take our oral exam, 27% failed in 2023. And that means they simply didn't know either enough Spanish or enough English, or didn't know how to interpret correctly. Right. So, and again, that's to me is having this, mechanism to ensure that people who do not know how to do our job do not do our job. That's, I think, is a kind of where I think of ourselves as a public safety guardrail against the unqualified individuals to practice interpreting.
Natalia, this is so important. And this was my primary motivation to do this podcast on certification because, the public often thinks that you are bilingual simply if you are able to carry a conversation on a specific language. And then they hire you in a position for which you are not qualified. And the other common misconception that you brought up is also that people that have tons of experience think that they are qualified to do the job. So they have been doing the job for, as long as years. Sometimes I've heard the people that have 15 years of experience and don't want to take the test because they know enough, or that's what they tell me, right? And then when they are actually tested, they don't know about parts of the code of ethics, or they don't have the fluency they should have, or many other types of mistakes that can be detrimental to the outcomes of people. So often that's one important misconception about experience that I wish people thought about, which is the fact that you have been doing this 15 years, 10 years, 20 years only means that you could have been doing it wrong 15 years, 20 years, etc.
Yeah, and
And
if I may pick up on this one, is, unlike in conference interpreting, unlike in court interpreting, unlike in translation, there is nobody in medical to catch you not doing things right. Right? Because think of it, court interpreters at some point will have to interpret a trial. right? And then you'll be working with a paired interpreter, and then that you could demonstrate that you're not really qualified. Conference interpreting, especially nowadays, it's almost always in teams, so there will be somebody tell what, don't invite that person for me to be with me interpreting anything anymore, right? Translation, hey, it's a written product, it could be reviewed by many people, and you identify mistakes. And in court also, there is a record, right? There's a recording. Somebody could review it later on and say, hey, this was wrong translation or interpretation of things. And medical interpreters, you are one-on-one with two people who don't speak each other's language. The patient may never know that you didn't interpret everything, and the doctor may never know that you interpret. And that's why it's so important for us to have all these safety guardrails and have a stricter requirements to getting certified than for other professions, because that's pretty much the only guarantee that the person can do the job and do it right, whether they have 1 month of experience or 15 months, 15 years of experience, because they passed the exam. And so that's kind of a unifying measure to let us start all at the same basis. And then we could differentiate ourselves by years of experience and being, more advanced and more knowledgeable about specifics. Because if you work in pediatrics and then you're thrown to geriatrics, I don't think you'll be the same, quality. You'll still not make the obvious mistakes that the bilingual will make, right? The main thing about, certified interpreters, they will not add and make up things. Never. Because that's an issue, right? And they will not omit critical things. They will always catch themselves. Oh, I don't remember it. I need to stop. I need to clarify, etc. They know what is right, what is wrong, and they can manipulate, not manipulate, but it's not the word I wanted to use. They can adjust their, you know, professional tasks performance to the situation, even though if it is difficult and new to them, they still know how to navigate it. And that's what certification also proves.
Natalia, just to finish that point, you are totally right. Only in other professions or in other lines of interpreting, your colleagues can sort of catch you and help you if you're making a mistake or improve the quality, except in medical interpreting. In medical interpreting, it's really the patient who can complain, or maybe the doctor or the nurse. But honestly, nobody else, no colleague will catch your mistakes, and that is unfortunate. So maybe the doctor might say, okay, this interpreter got too chummy with a patient, or try to offer other services, things like that. The other thing that you mentioned that I found interesting is that there is some kind of ethical compliance at CCHI, which I wasn't aware of, which I think is great. One of the major gaps, I think, in our profession is that there is nowhere to say, hey, this interpreter should be assessed or evaluated in some way because they are not doing their job as they should. And the fact that CCHI offers that, it's a great advancement, I think. So, to all our listeners, having a certified interpreter for healthcare makes the difference and can make the difference between life and death. So, that question was pretty much, we could do an entire podcast on only that
Absolutely.
question. So I am going to do a follow up on this. What are some of the key challenges you have faced in advocating for upgrading the standards of the interpreting profession in healthcare? And how have you addressed them through your work with CCHI?
Well, there are many challenges as well. No, but I'll just try to focus on just a couple. So the first one is pretty obvious. There is no federal mandate to be certified to work in the US as medical interpreter, right? And that is a challenge because it allows individual employers, but be it language companies or health system, not to require that, right? And what as I demonstrated earlier, going over the definition of qualified interpreter, that is the direction we take at CCHI to educate healthcare providers, to educate language companies about the fact that if they deal with certified interpreters, then they're meeting those legal requirements to utilize only qualified interpreters in a very standard way, in a very easy way, and they kind of are transferring the liability to a certification body versus being liable for every person whom they hired who is not assessed, right? And it's a long and difficult path, because ultimately, because there is no national requirement, it is one health system at a time. We have made huge progress since we started in 2009, but there are still, even within one state, there are still discrepancies. You can have a hospital which requires uh, their interpreters to be certified and the one who doesn't, right? And we all still have language companies that have certified medical interpreters who, work remotely, but they're not utilized strictly for medical interpreting. They could throw them to interpret in other calls that come in. And to me, that's just a, inefficient use of talent. So there are this kind of, that's the major challenge. And of course, one of the paths we see is that I think as a profession, we're getting ready to start this advocacy towards gaining that national recognition, as nurses and doctors do. It's not like there is a federal mandate for nurses or doctors to be certified, but each state has the requirements to be, meeting certain parameters before they can practice, and so we could work towards that. So that's the legislative path. And then the other obvious challenge is how can we attract beginner interpreters or currently practicing interpreters to become certified if not every employer has a differential pay for these two different types of interpreters, right? Because ultimately, if you're certified, you bring more value to the health system. It's easier for the health system to meet all the, like joint commission review requirements and meet with the legal mandates for language access and the safety and risk management parameters, all that certified interpreters bring with them, so they do deserve to have higher pay. And with that, what we're planning to start this fall is we're planning to start a regular national healthcare interpreter workforce survey, where we'll first start collecting the data about the pay of interpreters, about their work environments, about their conditions, what are the breaks requirements, etc. And so, based on that data, then we hope we could start having some information with which we could go to employers, to HR, to legislators as well. Because if interpreters are employees, they need to be treated as any other employee, and we need to make sure that we have some data first. So that's why we are truly looking forward to that regular survey of the workforce that will help us become better advocates for the profession.
And on that note, can you share any recent advancements or changes in the certification process that aim to improve the standards and recognition of healthcare interpreters?
Well, one of the advancement, as what we see it from internally, is this introduction of the core CHI performance credential, because what it did, it closed the gap. Because before, there was the conversation like, well, Spanish, Arabic, and Mandarin, these are full certification because they have all skills exam and they truly demonstrate they can do it. All the other languages have it easier and they don't have that component. Now we have the system where any language has two components, written exam and the skills exam. And that is the actual certification update that allows us to go to employers and to say, certification is available for any language. Why do you have Spanish requires certification of Spanish interpreters, but why don't you require certification of Burmese interpreters? Because they can be certified too, right? And there is no excuse to allow hiring of less competent individuals to do our job anymore. So that's what one of the advancements. And then another one, I would say, because of that credential, we have updated our language proficiency requirements for languages other than English. And again, it's a safety assurance for the public that because that credential is based on two English exams, right? We wanted to have assurance that we truly have people who can speak those languages, and the language eligibility requirement is like the front gate that keeps individuals who are not able to prove their language proficiency from entering the profession. So we didn't do it via test; we're just doing it from accepting somebody else's test to prove that they're proficient in languages like, French, Dari, Cantonese.
Mhm. And you mentioned policies in a few questions ago. Are there any policy changes that have helped you the most in leading CCHI and promoting language access, or are there any policy changes you would want to see in effect to raise the quality of healthcare interpretation?
Well, of course, the Section 1557 of the Affordable Care Act is the final rule on that section. Um, Helps us in terms of the definition now pretty much means that you need to be certified, right? You can interpret it differently if you stick with the letter of the law, but if you truly want to get to the proof of it, then you have to get certified, and that helps us in promoting certification. But also, we want to actually see something maybe at the state level where there is a mechanism that if you do not work with certified interpreters, you do not get the same level of reimbursement for interpreting services in the states where it's reimbursed. Because why should the state reimburse at the same level if the interpreters are not qualified, right? So that's what we want to see, like something like some specific either state level or federal level policies that help certified interpreters make a living by doing their job, and make a living that's comparable to nurses and other allied health professions, and not, have our profession only as a sidekick, which it is for many of the interpreters still, because the level of professional knowledge and training that we take equals that of a physician, right? We all have to, we need to keep in balance the two languages or more. Uh, and that takes years of training and even maintenance. I've been in this country since 96, and I have to work on keeping up my Russian, because I don't talk it every day with somebody, right? So the same thing applies for newcomers. They have to work at their English because they may have a knowledge of it as consumers, but not at the interpreter's level. So yeah, I look forward to the policies that would, require use of certified interpreters.
Natalia, I am very familiar with the certification process, for example, for Spanish, but I know that CCHI certifies a bunch of languages. Can you tell us a bit about what step is CCHI taking to ensure that interpreters from diverse linguistic and cultural backgrounds have access to certification and professional development opportunities?
Yes, and that's again our new credential that we introduced last year called Course HI Performance. That's available for interpreters of any language, and the knowledge exam is the same as for Spanish, Arabic, and Mandarin. But the skills exam, what we called English to English or E2E exam, is different because it assesses your ability to engage with the language without going to the second language. Right? To give you an example, all interpreters first need to understand what they hear. So on the E2E exam, there's listening comprehension items where you listen to the speech and then you have to restate the key points that you heard, right? We also have a reading comprehension. Same thing. You read a text about medical topic, and then you need to answer the questions. So this, two activities kind of kill a couple of birds: your understanding of English, your understanding of medical context, and your ability to speak and retain the information. So that's one part of the exam. Another, the core part of the exam is about your ability to paraphrase, to restate the meaning. Because what do we do when we interpret, right? We take a meaning in English and then we convert it into the other language, and then we do the other direction. So, what this English to English exam test is your ability to restate the meaning in English in a different way, using synonyms, using, maybe a longer explanation of the same terminology. And what we notice with those who pass and fail is that those individuals who cannot do it accurately, they simply either omit the information, or they will misunderstand the information and use a term that doesn't really match what they heard originally. So, and that proves this meaning transfer cognitive abilities that underlie the interpreting skills. So that's, another types of test that we testing items that we have on the exam. And we simply have a very simple straightforward memory uh, you know part of the exam, where you need to just repeat what you heard. And the funny thing is, if we start with about 12 words and then we end with about 35 words, different things. And by the time we get to 35, 35 is just your normal utterance of about two sentences, right? Interpreters can actually do it. And if you don't have the skills, then you omit something. And what you omit is very telling. If an interpreter can't remember something from the context, they could reconstruct the meaning and they can, paraphrase it or summarize it, but they won't omit some critical information. And bilingual individuals who don't have that skill, they simply omit random things, including some important information. Like for example, hepatitis C is a leading cause of liver cancer, right? And we've had that was the item from our study that we did it. And so some of the candidates will say hepatitis B is the cause of cancer, or they'll say cancer is caused by hepatitis C. Well, first of all, liver cancer is not always caused by hepatitis C, right? So that's the indication that this is a person who heard some words but doesn't really isn't even able to reconstruct the meaning, while interpreters will be able to, they may omit the word leading. It's still not good, but that the rest they won't change. So that's kind of is what this exam does, is helps us distinguish between bilingual individuals who don't know what interpreting is and those who can do it.
Yes, a lot goes into calibrating these exams, I'm sure.
That's
And
right.
it's amazing that CCHI is the only organization with programs accredited by the NCCA. And I think this is very important for consumers to understand. Can you tell them why is this important?
Thank you. This is a great, question and a very dear question to us, because we did it from the very beginning. When we designed the certification in 2009, we wanted to make it comparable to certification for doctors and nurses. And when we did the research, we really realized that the National Commission for Certifying Agency is the organization in the United States that accredits those exams. And they accredit exams for all other professions. And what they ask in the accreditation is pretty much three things. One is that your whole governance, the body that issues certification, CCHI in this case, is not biased and represents the interests of the public, right? So it's think of the same thing like the medical boards or the bar, right? They're not really representing the interests solely of doctors or lawyers, right? They represent the public interest that the individuals who qualify to practice law or medicine can do it. Same thing, CCHI. While we have interpreters on our board, they're not the only representatives on our board. We have managers, we have interpreter trainers, and we have a public member. And the public member currently is Mara Udelman, who was one of our founding commissioners, but she came back after a break of over 6 years. So that's the one piece. Part of the governance is also that we have policies that benefit the public, and that disciplinary policy that I spoke about earlier is one of these, guardrails for the public, that we actually demand that our certificants follow the codes of ethics, that they are sustaining their, integrity as a person. Because if by our regulations, if you're convicted of certain crimes related to healthcare interpreting, we will revoke that certification too. So it's a very formal, thing. And also it checks that if we have financial stability to sustain that this credential is not good just for 1 year and then employees have to search for something else, that we actually will be hopefully living forever from the beginning, from the inception. The second part of this accreditation looks at our tests, that they're developed with the psychometric standards that are currently considered, you know, um, uh, appropriate in the society, because psychometrics and statistics is a science that developed, and it didn't really exist in the 80s when, for example, ATA exams or National Federal Court exam for Spanish was developed, right? But now this is formed science, and we have to meet certain parameters. We, for example, have to update our exams every 2 years. We have to conduct job task analysis to update the content of what goes into the exam every 7 years. So and then we have to report to the NCCA every year on the data of how reliable our tests, how consistent our scores are, how many people get appealed our decision, because we have appeal process. And then the third part of the accreditation requirement is the requirement to be transparent to the candidates. And we have our annual reports published, all descriptions of how exams are scored, what's the percentage of the questions, and what kind of questions are on the exams. All that is available, because it's not like, if you go to take many private exams, they will tell you, well, pay the money, come to the exam, you'll find out what it is, right? We're not like that. We have
Good
to,
point.
explain what our exam is. And again, another, independence guardrail is we cannot train for our exam, and we cannot accredit programs that train for our exam. And that's the major, conflict of interest policy, because if we know what our exam is, if we start training for it, we can make a lot of money because then people will pay for our training and they'll pass our exam. We cannot do that. That's why we explain about the exams and we're transparent in what it has, but we do not train for it. And that's an important distinction for
And
us.
I also think it's important to underscore that, because even though you mentioned it's knowledge based, it's also skill based. So the best way to prepare for the CCHI exam is by practicing, practicing, practicing. I think this is very important to understand. I get a lot of questions about, oh, where should I find material for the certification exam? And that's what I tell them. I mean, you have to practice, because it's a skill based exam. And the other thing that I think is important that to clarify is that even though you don't say like, okay, you can practice this and then take our exam, they do have minimum requirements, right? You have some level of requirements for people before they take your exam. Is that right?
Correct. Yes. And our, eligibility requirement is have to have high school diploma. The reason is that we need to make sure that you are capable of understanding scientific principles of medicine that are deployed in the United States. Then you have to have at least 40 hours of healthcare interpreter training, right? For many exams, there's no requirements. You just can walk in regardless. But we require that because we don't want people who didn't invest in the profession to take the exam and fail and then say, hey, well, you just after our money. We're not after the money. We're after the safety of the public. And then language proficiency in English and in the language other than English that I was just explaining earlier. And with the preparing there, one of the things that I think is very often overlooked, and I know every trainer says that, but candidates, especially if they're brand new, right? If they never even did interpreting ever in their life, what they don't understand is, unlike many other professions, the way to practice is just to record yourself and listen and compare, right? Because you have audio input and you have audio output. That's what our profession is. So listen to an audio or YouTube video in English, record yourself interpreting it into Spanish, and then listen and compare. What did you forget? Why did you forget? So, and unfortunately, there is no other easy way to improve. When you learn the terminology, when you understand the healthcare process and the settings, etc., then the only other thing left is just practicing this and identifying where you miss. The number one reason why people fail our skills exam, both CHI and E2E, is because they omit things. It's not even mistranslation, right? It's not even the fact that you called lung heart. No, that's not that. It's you omitted something, because on the exam we have your recording. What our raters do is they listen to the recording and they listen to the prompt, and whatever you omitted, if you omitted critical information, and in our exam, pretty much everything is critical because we're testing you, right? So if you omitted it, that's what is detrimental, because think of the simple phrase, take this pill twice a day with food, right? If you omit it with food, everybody can say it. You don't have to be an interpreter to say with food. Then you omitted an important medical instruction. If you, instead of twice a day, you say 12 times a day, again, everybody knows the word 2 and 12. Even I know it in like 10 languages. But it doesn't mean the thing is, the interpreter will never make this kind of mistake. Or they'll realize it, even on the exam, they'll realize and say, no, 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 not 12, 2, 2. And we count on our exam the last version. You say, you're allowed to correct like in real life. We all can have slips of the tongue, etc. So, but that's the important distinction, that this is truly an interpreting exam, seeing how your brain works, not just do you know the words.
Yes. So, as an expert on interpretation accreditation, what would your recommendation be for healthcare organizations seeking to improve their language access services and support for interpreters and other bilingual personnel?
Whew, that's a very loaded question, right? With many different things. Let me start like teasing apart different parts, and I'm not going to get to all of them probably. So, first of all, if you are a healthcare organization, you need to know who your patients are, right? Who live in your area. You need to know what languages you need to have. And you need to have an approach is that you have your services available to them at the same level that it is available to English speakers. That means you need to most likely have your in-house staff, interpreting department, and you need to have a remote or language companies to substitute this, because you'll never meet the demand just with internal staff or just with remote interpreters or just with local agencies. You have to have usually like a multi-prong approach to that. And when you do that, it's important that you have the same hiring standards for whether it's a staff person or if it's a contractor for a language company. When you're hiring and evaluating language companies, you have to ask, do they have qualified interpreters? And if they say, oh yes, we do, you ask them, how do they qualify them? And if they don't, if they have like, well, we have an interview with them, all right, what languages do you speak that you interview? Do you speak all the languages that you interview? So that's kind of is the first thing, that you need to have policies in place. You need to comply with section 1557 that actually requires you to have a person in charge of complying with that section. And then because it still is easier to interpret something that you need to recruit your staff interpreters locally, because they will know what is this particular community in your area. Like, for example, in the area I'm from, there are a lot of migrants workers who are actually from Guatemala. Yes, they speak some Spanish, but their main languages are not Spanish. They're Mayan languages. So you need to understand that. And you need to, have Spanish interpreters, hire Spanish interpreters who know how to do relay interpreting. Not that they will know Mayan languages, no. Most of the times they wouldn't. But they will know how to help that Mayan interpreter who speaks only Spanish and, let's say, Quiche, how to interpret for them. And then Spanish will interpret into English. So not every Spanish interpreter can do that. They can only do it the more they practice, right? So those kind of things, like, you really need to know your situation and create the language services tailored to your community. And when you are successful with that, and that's what we saw in COVID, health systems that had this in place did not have any problems interpreting during COVID, outside of the normal ones that everybody had, right? But those who only had the check marks, oh, we have a contract, who will call when what they discovered during COVID times, that suddenly, instead of needing the interpreter 2 times a day, they needed them 200 times a day, because before they had only a remote contract, and majority of patients brought their family members to interpret for them. And during COVID, family members were not allowed. So just things like that are very important to consider for organization. But how do you support interpreters and bilingual personnel? That was your second part of the question. To me, here it's important to understand that interpreters need to understand your organization. So you need to invite them in decision making processes, and regarding everything, including Epic, including computer upgrades. Because right now, one of the things many people will start considering, let's buy AI things for interpreters to make their lives easier. If you don't ask interpreters, what you'll end up with is the system that is not interpreting. I know of, kind of a story where there was a seller, a developer, software developer, selling a product as interpreting to a health system earlier this year. And then at some point they were asked, okay, so we understand it'll be interpreting English into Spanish, but what about Spanish into English? And developer said, oh, no, it doesn't do that. So for us, interpreting is bi-directional by default, but for tech people, no. For
Right.
CEOs of large health systems, they don't need to know all that we know. So it's important for health systems to invite interpreters to everything they do. And at the same time, we interpreters need to show up and volunteer for these committees, for HR committees. Because think of it, if there's anything that contributes to HR process at an organization. Let's say they may have some special money stipend paid to nurses for renewing their certification. Well, the same money should be paid to interpreters. But if
Absolutely.
HR doesn't know that we have a certification and the continuing education requirement, how would they do that? Same thing when they have trainings for nurses, right? They do CEs for nurses, CNEs, CMEs for physicians. Interpreters should be part of that, because we also need to improve our knowledge about healthcare. We're reproducing what they say. How would we reproduce it if we don't know what they could say, right? So those are the important parts. And with the bilingual staff is, sometimes the best way is to have your physician speak your language. And in some languages, it is possible. In this
Mhm.
country, it is very possible for physicians and nurses to speak Spanish, Chinese, both Mandarin and Cantonese. I'm talking about the West Coast more, Portuguese and, New England. So, but you need to test them. You need to assess their language proficiency, their standardized exams available. They're relatively cheap, much cheaper than for medical professionals. And then you could be complying with the law. And you also will have the, community that will know that you have qualified individuals who could deliver care. So, don't buy the fact, oh, how dare you, I'm a best neurosurgeon in the world, and to test my Spanish. First of all, best neurosurgeon in the world will take the test and won't even worry about it, because if they truly speak Spanish, they'll pass it. So it's an important part to understand that language access has so many pieces to it that you and I could talk about for weeks. But thank you for the opportunity to at least just get into this, surface things. So
Natalia, thank you. I think that very important everyone that interprets at your hospital should be certified if possible. Everybody that wants to use their language, if they are a doctor, a nurse, and they are bilingual, let's say, they have to test themselves as well. And just for clarity, that kind of test is different than the CCHI test. And also the participation in different committees. I think that's such a valuable point. I remember when I worked for Johns Hopkins, one thing that happened, this is a short anecdote, they built the new towers, the new hospital basically. And one key stakeholder that wasn't there in the planning was language access services. Why was it important that they were there? Because if they are planning this new hospital, they have to know, okay, how are we going to connect the technology? And this was years ago, so we needed phone jacks for that, for example. And so by the time they were unveiling the big hospital, they didn't have phone jacks, and we had to do different things to be able to communicate the interpreter. Now it's different because now everything is over Bluetooth, etc. But that's just an example of how you should include language services in any planning that you do. Thank you for that. And briefly, we are finalizing our podcast. I want you to briefly mention what are the new initiatives and projects that CCHI has in the next 6 months.
Yes, thank you for that question. Well, first thing coming July, after July 11th, we're going to open nominations for the 4 vacancies that we'll have on our board of commissioners. So we hope that individuals will apply because our commissioners are volunteer. They represent different stakeholders in our field, and we really, like to see new interpreters, practicing interpreters, to be applying as well, especially, interpreters of Spanish, because 2 of our Spanish commissioners will be actually 3 Spanish will be ending their term. So we'll be looking for Spanish interpreters to add to our board. Then we have an initiative that is meeting quarterly. It's National Language Access Leadership Huddle. So the next huddle is on July 26th at 12:30. We truly hope that, more language access leaders join that. It's a, informal gathering where we talk about different things. And if I remember correctly, this time we plan to talk about indigenous languages and how to provide interpreting services in those. Then, as I mentioned earlier, we are planning this fall to start the National Healthcare Interpreter Workforce Survey, so please participate. We're also planning to gather or convene an advisory panel for evaluating language proficiency tests. We're hoping to have a virtual event, continuing education event for interpreters with performance-based training this fall. And last but not least, we have 2 more initiatives that I'm not going to tell you, but watch out for them because they relate both to language access leaders, companies, and healthcare systems that we want to collaborate with them to encourage better conditions for healthcare interpreters. So we're continuously coming up with ideas, and we hope that your listeners could keep an eye on us and also spread the word about things that they learn. So thank you.
Thank you, Natalia, and I hope I can participate in some of those initiatives. I look forward to that. Lots of initiatives there and a lot of information, really, really juicy information in this podcast. Thank you so much. It was an honor to have you, and good luck.
Well, thank you, Carol. Also, it was a pleasure being on this podcast, and I hope you have, more and more listeners tuning in for it. So thank you.
And that wraps up another enlightening episode of Language Access Matters. We hope you have enjoyed our discussion on the profound impact language access has across various sectors of society. Let's remember that language access is not just an isolated topic. It intertwines with various fields, impacting lives and businesses in profound ways. As we continue this journey together into becoming a more inclusive society where we ensure equal access to services to those who don't speak the dominant language, we want to assure you that our company, Equal Access Language Services, through its podcast Language Access Matters, will be with you every step of the way. We are committed to bringing you thought-provoking conversations, expert opinions, and stories from the field and beyond. To dive deep into the subject matter and engage with leading experts in the field, we will release a new episode of Language Access Matters once a month. By featuring expert practitioners and individuals with diverse experiences, we aim to broaden the scope of our discussions and present a comprehensive view of the importance of language access. We encourage you to stay connected with us through our website, www.equalaccesslanguageservices.com, and our social media platforms. You can join the conversation, ask questions, and share your own stories and experiences. If you want to be part of our podcast, email us to podcast@equalaccesslanguageservices.com. Remember, language access matters to each and every one of us. By understanding its significance and actively working towards its advancement, we can create a more inclusive and equitable society. Thank you for being a part of the Language Access Matters community. We appreciate your support and look forward to sharing more knowledge, inspiration, and empowerment with you in our future episodes.